জিপটা একবার বের করুন। ট্রেমর টাং। হাত দুটো সোজা করেন। এবার একটু অল্প হাঁটার চেষ্টা করেন দেখি, ধরে ব্যাগগুলো রাখো না, তোমার ওগুলো difficult to movement, tremor and trembling of the parts of the body, cannot walk alone properly, fear, anxiety and nervousness, please come back and sit down. So this is the typical case of Parkinson's disease, my friends. PD. The cause is generally unknown. That's why the another name of the disease is idiopathic Parkinson's disease. Another name, the old name of the disease is paralysis agitans. It was first described by Dr. Parkinson in 1817. It is a degenerative disorder of the neurons in the substantia nigra, a part of the basal ganglia of the brain. The basal ganglia of the brain fail to make dopamine secretion. The secretion is nothing but a neurotransmitter, and it usually comes on in the later life and can become disabling. Various antipsychotic or antipsychotic drugs or anti-epileptic drugs may also produce this disease. So Parkinson's disease, I have shown a living example of this case. It is characterized primarily by bradykinesia, a rigidity of the muscles of the body, tremor. I have already shown the tremor of the tongue and the fingers and the extremities. In this case, the tremor is not marked because this is the initial stage. There is loss of postural reflexes. Already you have seen the gait of the patient and developed postural reflex you have understood. So this is our Parkinson's disease, my friends. While motor symptoms are the most common presenting features, but non-motor symptoms, I mean the cognitive impairment, is also found. Depression, anxiety, fearfulness, restlessness of the mind, etc., which become increasingly prominently as the disease progresses and significantly reduce the quality of an individual life. Although mutations in several genes have been identified, in a few cases, in most patients, the causes remains unknown. The pathological hallmarks of Parkinson's disease are depletions of the dopamine. Already I have told the loss of this dopamine, which is nothing but a neurotransmitter, is responsible for signifying the clinical manifestations. I have already told the non-motor symptoms are mainly the cognitive symptoms, anxiety, depression, etc. And also the symptoms belong to the digestive or alimentary system are important. Example, constipation. Although features are initially unilateral, gradually bilateral involvement evolves with time. Cognition is spread in early disease. If impaired, it should trigger consideration of alternative diagnosis such as dementia, etc. Now, the main symptoms which I have already been discussed, that the characteristic rigidity of appearance and movement of the patient. The face tends to be mask-like, showing very little emotion which has been expressed. The patient walks with small shuffling steps, and another main symptom is tremor of the parts of the body, which is very common and most marked in the hands and the feet. There is a constant rolling movement of the fingers and thumb. This tremor may be very severe in some cases, affecting other parts of the body, though in this subject the tremor is not more marked. But already I had shown you many cases where the tremor is very, very marked and established. Speech becomes slurred, soft, and monotonous. I am showing the soft and monotonous speech of the patient. নাম বলুন। বাড়ি কোথায়? খর্দা। কি কাজ করতেন আগে?
আমি আগে ব্যবসা করতাম।
কিসের?
চা পাতা।
চা পাতার ব্যবসা।
দোকান ছিল।
So Parkinson's disease, this patient is not fully developed, the initial stage of this patient. The diagnosis is usually made clinically from the typical appearance, walking, and the tremor. In homeopathy, there are so many medicines, my friend. Our most important medicines, according to symptom similarity, is Hahnemann's tincture as sine acris cal. This patient is chilly, warts and moles here and there, sympathetic mind, and there is company aversion, stool and urine sometimes involuntary, cannot control. So considering the symptomatology of these patients, I like to prescribe causticum. So causticum is the choice of medicine for this patient. With the direction thrice in a day.